My name is Frank Haney, Winnebago County Board Chairman. I am joined again with Rockford Mayor Tom McNamara and Dr. Sandy Martell, the Winnebago County Public Health Administrator. I'll be very brief in my remarks today. I'm very concerned when I hear public health and medical experts around the country and folks expressing concerns locally even of what we're seeing in other parts of the country that opened up sooner than we did. And so that is a reminder to us to stay vigilant around things, again, not to be a broken record, but things we've been talking about for 3 or 4 months. The work we did to get ahead is going to have to be the work that we double down on to stay ahead in the weeks and months to come. And if we continue to stay vigilant around mask wearing, around social distancing, washing our hands, that gives us our very best chance. We just, of course, last Friday moved to phase 4, which is something we all welcomed. And we do know and have acknowledged and will continue to the very tough plight of our business community, in particular our small business partners. And many of them have been the ones closed the longest and are now opening back up and finding their way in this new normal. I think we have an obligation to them as well as to our first responders, as well as to our frontline healthcare workers, that we continue to do the basic fundamentals of fighting COVID-19. The idea that we are allowing for the politicization of mask wearing is unacceptable to me as a citizen of this community. This is something we need to do. I wear a mask when I go into a store to protect you, and I ask you to wear one to protect me. If you're asked to put on a mask walking into a store, please comply. Business owners are going through a lot. They're adjusting. They're doing everything they can to open back up and stay open, and we want it to stay that way. We all have a role to play in this, folks, and so we do need your help. Whether, again, you are thrilled with every action that has been taken by the state, by the governor, or you've disagreed with certain actions along the way, at this point, that is irrelevant. All that matters is what we do today and tomorrow around slowing the spread of COVID-19. What is the one thing that has not changed? What is the one thing? The one thing is this. We know that that COVID-19 will be with us until there is a treatment or vaccine. And that has not occurred at this time and will not in the very near future. And so we have to continue to remain vigilant. With that, I am going to again turn it over to Dr. Martell. And I would again, for folks, regardless of what your political persuasion is, it is bothering me as somebody who grew up in this community, who's raising a family in this community, and is serving in this community now. I don't want to have political discussions about mask wearing. If this thing keeps people safe, if it turns out to save lives, if it slows the spread of COVID-19, then let's do it, whether we love it or not, and it will help us have the most opening of our economy the fastest, and for us to sustain that as we go forward. With that, I will turn things over to Dr. Martell for the public health update. Thank you.
Thank you, Chairman. I keep reminding everyone, even as we are in phase 4, that we're learning to coexist with COVID-19. I don't know how to put it any nicer, how many to make it feel better, but we are going to be coexisting. And I want to warn everyone that it will last longer than 28 days, as our other phases kind of move through 28 days. Because really, phase 4, moving into phase 5, will require either that we have an effective treatment or a vaccine. So we need to continue to both kind of look at our individual and our societal at risk. So the chairman gave me a great introduction on this. I want to be clear with everyone that risk cannot be totally eliminated. We cannot go to zero risk. But it's all about reducing the risk. So we're going to have a little conversation today for the public about what's safest and what's the highest risk or the riskiest. So safest, outdoors, wearing face coverings or masks, 6 feet of social distancing, small group size, less than 50, contact time less than 15 minutes. That is the safest, if you think about the framework. So we're going to go with what's the highest risk. Indoors, not wearing face coverings or masks, not maintaining 6 feet of social distancing, group sizes more than 50, and contact time more than 15 minutes. So think about, as we go through some of this, kind of a checklist in your own life about when evaluating, what am I going to do today? What do I want to do today? What should I participate in? What do I really want to put my energy and effort toward in phase 4? Because again, you have to assess your risk. I often hear about, the government telling people what to do. It's now time for you to assess what your risk is. So as we go into summer travel plans, so again, think about this. What would be the safest? We're coming up on our big travel weekend for many people to go out, visit, and enjoy things. Staying in a region or traveling to a region with the same rate or a lower rate of infection. Traveling in your own vehicle. Staying with your own cohort or household, so people that you normally keep in contact with. Wearing your face coverings and maintaining social distancing when you're out and about where you travel to. Travel plans for highest risk. Traveling to a region with multiple outbreaks and or higher rates of infection than our own community. Using a public mode of transportation. Why? Because you're in a group size. Staying with a new group or household. This is why there's concerns about things like cruise ships and things, where all of a sudden you're put together with households, multiple households and cohort groups that you've never been with before. And not wearing a face covering or mask or social distancing when you go out and about. I have to tell many of our, listeners, viewers, we get calls from other states asking about our infection rate and whether or not our visitors, when they go to other areas, are wearing their face coverings and are they bringing the infection to them. And I come back to, again, it's about safe, safer, higher risk. So each time that you're thinking about what you're going to do, what are you going to travel, what your plan is to do, think about how can I make it as safe as possible. Understanding we can't eliminate all risk, but how can we avoid the high risk? So here's a checklist to consider when you want to take on that risk. Can I afford to be off work for the minimum of 10 days if I become ill with COVID-19? Will my employer cover time off for illness that I acquire in the community? If I acquire the illness in the community, will my employer cover that time off? Am I at risk of requiring hospitalization if I contract COVID-19? Do I have an underlying health condition or an underlying propensity for a health condition in my family that may place me at greater risk? Do I have adequate health care coverage if I require hospitalization? Well, our hospitals have capacity. Is this where I want to be spending my income? Who will take care of my family member if I become sick with COVID-19? What will I do in the fall if COVID-19 cases increase and my children can't return to school? And my work, I need to return. How will I pay my mortgage or rent if I'm out of work? Are other people in my household at high risk? Do I have a pregnant member of my family? Do I have infants, children, parents, or grandparents? If we have to move back to phase 2, is my employment at risk of having to close because they can't maintain? And am I willing to contract an illness for which the long-term implications are unknown? I often hear, well, younger people get milder cases. What we don't know is in 15, 20, 25 years, whether you're at increased risk for another condition because this damaged some portion of your system. So I come back to the statement of, is it really worth the risk to you, your friends, your family, your colleagues, and more importantly, and most important as we come together as a community, your community. So while you have individual choices, you have to consider the impact overall. So as we went into phase 4, the COVID-19 and hotline continued to receive complaints from both businesses and establishments regarding clients and customers who do not wear masks, and from clients and customers who indicate that businesses and establishments are not wearing masks. Common theme here, not wearing masks. So the Winnebago County Health Department and the City of Rockford Code Enforcement will respond to repeated complaints to provide education and a plan for coming into compliance. But clients and customers should adhere to posted notices from businesses or establishments or risk not receiving services. And businesses and establishments should adhere to the guidelines issued by DCOE to reduce the risk. If you're an individual that needs accommodations based on health issues, make your needs known to the management team. And face shields can be used as an alternative. Public and private schools, as they enter, will be requiring students and faculty returning in the fall for in-person instruction to wear masks. And I come back to wearing a face covering or mask is a public health issue, not a political or a constitutional issue. So as we enjoy moving into phase 4, we're doing some changes in our reporting. Because the state of Illinois Department of Public Health is now reporting county level data, we will no longer be providing a daily report of county level data. The new website color codes the counties. If we're blue, that means we're good, we're stable, we're moving in the right direction. Orange means caution. So for those of you who are Illini fans, we've got the blue and the orange in this state. But I think it becomes important when you see it, we will be providing a little daily snapshot. And it will be color-coded either blue or orange to be consistent with the state. And it's more of a weekly analysis, kind of like a daily report to compare to the state, which is a weekly. And it's similar to how we do flu reporting at the state level as well. Because as we move into this phase, we're kind of resetting the clock a bit to kind of take a look and see how are we maintaining, how are we doing in relation to our new numbers. So we will be putting up the case count, the positivity rate, but you will notice that is not a cumulative positivity rate. That is a 7-day rolling average on the positivity rate. The recovery rate, and yes, we call it a death count. And I've heard that people might feel that that's a very harsh word to say, but understand the number of people in our community that have lost their lives to this infection. It is not meant to demean in any way those individuals. For every life lost, we are truly sorry and we grieve for them. But understand, those are those 4 numbers, a basic table to every day kind of take a look at as you assess your risk as you go out. And again, we've made this change to be consistent with local, regional, and state reporting. So today's numbers, we are reporting 14 new cases. Since we've entered phase 4, however, we've had 69 reported cases. Our total cases are now at 3,016. We have no new deaths to report, but our deaths are at 93. No new locations of concern, no new communities of concern. And while our overall positivity rate is about 9%, we are now, our last 7 days has dropped to 4.2%. And our recovery rate is at 95%. We've worked hard to get to these numbers. And wearing a face covering, social distancing, frequent hand washing, sanitizing of surfaces has helped us to get to where we're at. So as we look around states that have reopened and had to close down sectors or consider additional social mitigation strategies due to rising infections and hospitalizations, think Florida, think Texas, think California. Let's learn from them about what works. Wear a face covering or mask, maintain social distancing, and wash hands frequently. This is not hard, but we've got to do this if we are going to get through this pandemic and get to our vaccine. So next I'm going to turn this over to Mayor McNamara.
Thank you, Dr. Martell, and I just want to echo a number of the comments that both Chairman Haney and Dr. Martell provided today. Like both of them, I'm terribly excited that we are in phase 4 of the Restore Illinois plan. But I do want to take a second, as Dr. Martell just did, and go over how we got here and why we're in phase 4. Number one, I think we've worked really well together as a community. We've remained vigilant. We've avoided those unnecessary trips and those unnecessary large gatherings of groups. We've stayed away at times, as difficult as it may be, from friends and family. We've washed our hands, we've worn our face coverings and or masks, and the work that we've done has been working. This is not the same in other states. We've seen across the country in some of the most populous states that happen to open up a little bit more aggressively, that they are seeing tremendous spikes in their cases. They've seen a lot of increased pressure on their healthcare system and their hospitals, and this is a cause for concern for them and for all of us. The news here in Illinois, however, is much better. Case counts and loss of life have dropped. We have right now really strong healthcare resources here in our community and across the state. As we're seeing the public health news improve, we also understand that we have still many citizens and business owners who are continuing their struggle. At the city, we are continuing to work with our residents who are struggling due to COVID-19 to provide them with help in getting the food that they and their families need, as well as assistance with their utility bills and mortgage payments. We are also working with our business owners so that they can stay open and continue to employ their employees. We have a lot of work to do together to restore our economy. We have tremendously difficult days ahead of us when it comes to restoring our economy. But working together, I'm incredibly confident that our community will not just reopen, but we will rebuild a community that we want to see, and one that respects every citizen who calls it home. While we're seeing the signs of progress, we have to continue to be smart and be focused. And I think this is a common theme that you are hearing from all three of us today. COVID-19 does not care what month we are in. It doesn't care how difficult of a fight we've had for the last several months or what phase we happen to be in. It is in our community, it is in our state, it is in our country, it is alive and well. And just before I close my remarks, I really want to discuss face coverings, and this has been a topic now of all three of us, so hopefully it is getting home to all of you watching or listening today. So since Friday, we've now been in phase 4. The very same individuals who were emailing me and calling me about their concern of how they were going to keep their businesses open, how they were going to be able to feed their children because of all the mitigation efforts that we have had to put in place due to COVID-19, are now calling me again and emailing me again. But they're not emailing me out of concern for their bottom line. They're emailing me out of concern for our community and for their employees and for the health and wellness of their own self and their employees' children, because people are not wearing their masks or their face coverings. It is incredibly easy. I happen to choose a Chicago Cubs one because they happen to be the best baseball team in Major League Baseball, but you can wear any face covering you want to wear. It is an executive order. You need to be wearing your mask. To all businesses who happen to be watching today, if you're requiring all of your employees to wear masks, you're enforcing the wearing masks and face covering, thank you. For those of you who are not, you really need to be protecting yourself. You need to be protecting your employees and their families, as well as other citizens who are coming into your place of business. To residents and visitors, I get it. I wear glasses. It's one of the most annoying things ever when it fogs up. I understand the inconvenience, but it is literally just an inconvenience. Wear your face covering. When you're walking into a restaurant, wear your face covering. Respect them. As Chairman Haney mentioned, I thought he used a great word. We have an obligation to those frontline workers. We have an obligation to those business owners who have sacrificed so much for the well-being of our entire state and for our city of Rockford and Winnebago County, that the least we can do is play our incredibly small role that is incredibly easy to do. Wear a face covering. It's been mentioned, this is obviously not a political issue. It's simply a medical issue. I really don't care who you voted for, who you're going to vote for in the next election. I don't care what signs in your yard today, who you think sucks, who you think rocks. I don't care. Just wear your face covering. It'll make all of us a lot healthier and allow us to continue to move forward. Wearing a mask helps prevent the spread of COVID-19. It is that simple. It keeps you healthy. Quite honestly, it keeps me healthy. And by keeping me healthy, I then get to keep my 3- and 4-year-olds healthy. And when I talk about myself, I mean all citizens. So please, as we continue to make progress throughout the state of Illinois and in our own community, I'm just asking that you continue to be and continue to remain vigilant. Wear your face covering. Practice social distancing. And please, wash your hands frequently. Thank you.